First up, despite Donald Trump's ongoing anti-mask campaign, CDC Director Robert Redfield made it clear in a Senate hearing today he thinks masks are hands down the best way to protect ourselves from the coronavirus.
Face masks, these face masks, are the most important, powerful public health tool we have. We have clear scientific evidence they work, and they are our best defense. I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine.
His comments come after yet more misinformation from the president in an ABC News town hall last night on everything from masks to the threat of the virus itself.
They talked about don't wear masks, and now they say wear masks, although some people say don't wear masks. I mean, you have a lot of different ideas. It's going to disappear. You'll develop herd, like a herd mentality. It's going to be herd developed, and that's going to happen.
I think he meant herd immunity. That's the kind where we simply let the virus run its course. For the record, most experts estimate around 70% of the population would have to contract and recover from COVID-19 for the so-called natural herd immunity to work, which, if death rates stay anywhere close to where they are now, would mean millions more would die. Of course, Trump did say the virus would go away a lot faster with the vaccine, and now he's claiming that could be ready even sooner than Election Day.
We're within weeks of getting it. You know, could be 3 weeks, 4 weeks, but we think we have it.
To be clear, while some of the leading vaccine makers say they may know whether their product is safe and effective in the next few weeks, none expects to be able to distribute a vaccine until the end of the year at the earliest. And again, here's what the CDC director said in testimony today.
If you're asking me when is it going to be generally available to the American public so we can begin to take advantage of vaccine to get back to our regular life, I think we're probably looking at late second quarter, third quarter, 2021.
And that's the optimist take, with the World Health Organization top scientist telling reporters yesterday, quote, we're looking at 2022 at least before enough people start getting the vaccine to build immunity. So, best case scenario, we still have a solid year left of trying to control the spread of the virus with things like mask wearing, social distancing, testing and tracing, which is only getting harder now with kids back in schools and on college campuses. In just the first few weeks of the fall semester, thousands of new cases have been reported at colleges across the country, including at least 115 at Boston College here, most of which have come in just the last week. That's why the state announced yesterday it's taking over contact tracing efforts to help isolate the spread of the virus on campus and in cities and towns in which it sits. But many community leaders and students have been raising concerns the school has not been doing enough to get things under control, with the BC Student newspaper reporting large groups of students were still gathering over the weekend, many of whom they say were not social distancing or wearing masks. And as the Boston Globe reported today, citing reports from students, quote, the dining hall is open and students sit together inside in large groups. Sports teams continue to practice. Dormitories are largely full, with as many as 8 students living together in suites. Students continue to leave campus to socialize in apartments and neighborhood bars. So that's what they say. Here with what BC says is Associate Vice President for University Communications, Jack Dunn. Jack, it's great to see you. Thanks so much for joining me.
Thanks for having me, Jim.
Jack, there's been, as you know better than anybody, there's been a chorus of criticism of BC on everything from testing to tracing to transparency to distancing. You and the university have rebutted many of those things to the best of your ability. As an observer, it's almost like the administration and the stakeholders are talking about two totally different campuses. How do you reconcile these two different pictures?
Well, we admit, Jim, that we had a spike in cases last week. Through contact tracing, we realized it was attributable to some off-campus gatherings where students had gotten together to do things as innocuous as watch a basketball game, but they weren't wearing masks, they weren't social distancing. So it resulted in a spike of numbers. We're concerned about that spike, but since last week, we've had a steady downward trend in the numbers, the number of positive cases. It's under control today, and we're convinced that we have what we need in place to have a successful semester here at BC.
But it seems to be there are a lot of doubters. The Heights, which is the student newspaper, if we can put it up, comes out with an article on Monday. And first, let me read what they reported. They said no university officials were seen on site to enforce the university's restrictions this past Friday night as dozens of students gathered adjacent to residence halls, many not wearing masks while standing in close proximity. And then you responded by saying it was a quiet weekend with no incidents that was the result of raised concerns among students after last week's increase in positive cases. Those are not talking about the same picture. How do you reconcile that?
Sure. I was asked by a Globe reporter about off-campus incidents, and I said it was a very quiet weekend, which it was. There were no police reports. There were no incidents. So the Heights misconstrued that. But the reality is, Jim, if you go to a supermarket, if you go to a shopping mall, if you go anywhere, you will see people who occasionally aren't wearing their masks. So it's on all of us to remind students, remind every member of the community to wear masks, to practice social distancing. We're doing that. We're telling our students that we'll hold them accountable. And we think we'll be successful in reminding them of the vital importance of following those health guidelines.
Let's talk about another guideline, probably the biggest debate in this country and one of the most important things, testing. The facts are that BC has been doing less rigorous testing, I assume you'd agree, than some of the universities, than the other universities in town. But you're quoted as saying that if you are symptomatic and you call health services, you'll get a test the same day. Here are two students in this morning's Boston Globe, and I'm sure you read it. Francesca Lynch, she had symptoms. She was turned away from the health service twice before she got tested. Tommy Merida did the online thing at BC. He got the red X that says you need a test. He called the service 3 times. He says, no answer. He was tested 6 days later. 6 days later. As you know, you don't need to be an epidemiologist. 6 days later is essentially no test at all. So you're not testing at the level that was promised and that you guys are suggesting you are you?
So let me try to explain it. In the first case, the student tried to walk into the asymptomatic testing area. And anyone who presents symptoms should not go to the asymptomatic testing area. They need to go to the symptomatic testing area. Why? You don't want students who are potentially sick standing in line with students who are just getting routine testing. So that explains the first case. In the second case, my understanding is that the student called health services. The student had already been tested before, called health services, and didn't get a quick answer. And we have added staff in University Health Services to make sure that no calls go unanswered. So I regret that those were the cases for those two students, but I think they're issues that we've been able to rectify.
But I think, Jack, at least from what I've read, and I don't have firsthand information, I know you do, those are not the only cases. There was a commitment, I'm told, to students who were resident assistants, which I was about 40 years ago when I was at New York, well, longer than that, at NYU Law School, and dining services workers. They were promised they'd be tested weekly. They're saying there's nowhere near weekly testing. Is there an explanation for that?
So we had agreed that we will test all what we call high contact people on a weekly basis. So they have all been called to come in for a test this week, and we'll continue to do that on a weekly basis moving forward. So maybe we were lapsed in that area, Jim. We had thought that we would, they were all tested when they came, obviously, and several have been tested twice. But this week, all people who are in that high contact position were invited for a retest, and we'll do the same next week and every week moving forward.
You know, one more testing question, if we can, Jack. There's no question BC is a great academic institution, and obviously it's developed some pretty good sports teams too. But is it true that athletes are tested more frequently on campus than students and faculty are? And if that's true, why?
Well, members of the football team are tested more frequently. Why? We are part of a conference, the Atlantic Coast Conference, and it's one of the Power 5 conferences, 4 of the 5 Power 5 conferences that intends to play football this fall. So the conference regulations are that all football players who are in competition have to be tested twice a week. That's why. So many other students, anyone who's doing a practica, as we said, the aforementioned students in high contact areas, RAs, et cetera, will be tested on a weekly basis. And yes, because of ACC rules, football players are being tested more frequently.
Even if it's an ACC mandate, and I'm not questioning, I'm sure it is if you say it is, doesn't that send the wrong message from a place like BC that wants parents and students to know, number one is the student, not the student athlete, not the football team, it's the student. And it does send a pretty crappy message, doesn't it?
Jim, I understand the question, and you can argue the optics, but we're in a conference with other academically excellent schools, University of Virginia, University of North Carolina, Wake Forest, schools with whom we compete for students, and they follow the same rules because they're part of the ACC conference. So it's just a reality of being a conference member.
How about transparency issues? This is something I care about a lot in the world, and I'm sure you do too. You obviously have read that there was a lifeguard who didn't want to be identified in the Boston Globe, saying she or he, I'm not sure, was not told that 2 of the swimmers tested positive. The Graduate Employees Union says they're being put at risk. One of their members, this guy, Derek Brown, a theology graduate student, said in the Globe there were 2 positive kids in his class. He wasn't told about that. That's indefensible, is it not?
So, Jim, as you know, there are HIPAA restrictions for all colleges and universities that preclude faculty members being given information about students because that information is private. So we're working to find some common ground where we don't violate HIPAA, where medical professionals aren't divulging information about their patients, but we can find a way to inform members of the community regarding spikes. So that's what we're working on, and we think we can find.
How about anonymity? Why do you have to give names? Why can't you just say there were 2 kids in the class who were tested positive?
We've decided to try to address this issue through a committee, and we're trying to find a balance to make it work as best we can.
You know, a couple of nights ago, I had a couple of an infectious disease doctor, Dr. Nelson from MGH, and a public health doctor, Dr. Siegel from BU. We were talking about universities in general and the problems that are being faced. You're not alone in that regard, obviously, around the country. And we focused on BC. And by the way, I want you to listen to their responses. This was solely based on the number of cases, not all the other factors we've talked about, just about what was then, I think, 104 cases. Here they are.
Now at BC, you've got over 100 cases. I think it's absolutely time to switch to an online system. What people don't realize is that the number of cases today, what it's telling us about is not what's happening right now. It's telling us what's going to happen 2 to 4 weeks, even 6 to 8 weeks from now. And so that's what I'm afraid of.
You know, I really share those concerns. I think that the 104 cases may just be the tip of the iceberg. Unlike some of the other local schools, local colleges and universities, they don't have a rigorous testing program, and it makes it such that we don't really understand how extensive this outbreak is. It may be quite a bit worse than what we understand at this time.
Is all online being considered, Jack?
Jim, I think it's important to note that we had that spike, which we acknowledge, and then we've had a steadily decreasing number of cases, just 5 yesterday and 4 today. So I think it's important to understand that the case is under control. I also think, in all due respect, wonderful doctors, great epidemiologists, but Boston University has had 98 cases in the same time frame. So I don't understand why the doctor would be singling out BC as opposed to Boston University, where he works.
Well, he actually singled out BU as well. He thought the School of Public Health should go online.
I didn't see that in the clip, so I wasn't aware of that. It wasn't in the clip. So,
Jack, before you go, in 30 seconds, if you can, what do you say to public officials who I assume you believe operate in good faith in Newton and Brookline and Boston, who have concerns about the state of affairs despite what you've said? What do you say to them quickly, if you would?
So we're concerned as well, and we think we have a plan that works for us. We have substantially increased our testing, and we're redoubling our efforts to communicate the importance of following those guidelines of wearing masks, socially distancing. We think it's a plan that can work for us, and we'll redouble our efforts to do our best to make sure we can have a safe and healthy semester.
Jack, I really appreciate the fact you came here to talk. Thanks so much for your time, Jack Dunn.
Yeah, thanks for having me, as always. Thank you.
Pleasure.